Hey guys, so today is December 27th, which means it is exactly 1 month after my finger amputation. So I actually just got back from a doctor's appointment and a therapy appointment. I thought I would just fill you in on how I'm doing. So the doctor said that everything was healing really well. He said that I have some pretty thick scarring, which isn't necessarily bad, but they're gonna do some work to try to eliminate the thickness of the scar just so it looks normal, and that there isn't too much buildup underneath the scar itself. And so to do that, there's some therapy things that I'll mention in a little bit, and then also he mentioned getting something called a scar pad, which they have at CVS, and basically it applies some constant pressure, which I guess just kind of breaks down the skin around the scar to prevent buildup and thickening, which they do not want. So he said that everything was going as well as it should be, which is great, and then he sent me up to therapy. So in therapy today, they told me that I no longer have to wear my brace, which is really nice, and then the glove that I got for swelling I no longer have to wear unless I feel like I'm having a lot of swelling one day. I can put it on and kind of help with that, but if not, I don't need to wear it. And then I got some putty to work on strength, so basically just kind of pressing down like that, just getting strength, and then pinching like that. Surprisingly, it's a lot harder than it looks. And then going in between my middle finger and my thumb, and just kind of squeezing it together like that. And that's going to help with strength. And then I had mentioned to the doctor that I'm having a lot of phantom pain, so a lot of itching where there's not a finger, and a lot of times it feels like I really have to pop my knuckle, and it's painful, but there isn't a knuckle there to pop. So we're working on desensitizing some of that area where the nerves are, which is down in here. So I'm going to start off with dried lentil beans, and you put those in a big box and you kind of dig through them, and that helps with the tissue not being so sensitive. And then once I get adjusted to that, I'm going to move on to dried kidney beans and then dried rice after the kidney beans become kind of no longer effective. And then I also started this thing, which I'm going to do twice a week, I believe, for 6 weeks, and it is ultrasound therapy. So they do the ultrasound goo on my hand, and it's like this little wand, and they just kind of go back and forth and massage it along my scar, and that helps to break down some of the tissue beneath that scar to prevent it from getting too thick. So I'm going to start going twice a week, like I said, and having them do that, and they do that for 8 minutes. It actually feels really good. It's kind of like I'm getting a hand massage, which is nice. But that's about all I did in therapy. Personally, I think that I am a lot further along than I thought I was going to be when I was going in for my surgery a month ago. So if you're wondering whether or not you should get this done, as of right now, I would say yes, go for it, because it's definitely not as scary as you'd expect it to be. And really, I mean, you get used to it pretty fast, and I've not had any major issues. So I will keep updating you guys as I go along, and thanks for watching.